18 Saturdays. That is 9 Saturdays alternating batch A with batch B. Having mentioned this, I come to the second program because FAP details have been already shown to you in the video. The second program is the district residency program. And both these programs are the vision of the Honorable Prime Minister of India, Sri Narendra Modi ji, who has been personally monitoring this program through the Union Health Ministry as well as the National Medical Commission. This district residency program is nothing but a dream come true both for Goa Medical College and the Directorate of Health Services. The DHS always had consultant specialists and they had medical officers in every specialty. What was missing was the resident doctor. And we at the medical college would train the PG students in tertiary level of care. Now National Medical Commission says that PG students who have finished 1 year of residency must have adequate exposure to a different work experience at the district level. As the state nodal officer, myself along with my two assistant nodal officers, Abhishek and Mahika, we have visited the South Goa District Hospital, North Goa District Hospital. The Director of Health Services has been extremely cooperative with us along with both the MS, and both the medical superintendents were kind enough to allow us for a healthy interaction with all their specialist doctors. We had a discussion about the program. The HODs and nodal officers of departments are already familiar with it, and so are the district resident doctors. The clinical postgraduate students in the second year of their PG will be posted only in their respective specialties. The surgery resident will work only on surgery. Medicine will only work in medicine. However, pre and paraclinical, including my discipline of community medicine, the PGs will be made to work in all the available avenues, including general night duties. The timetable has been prepared, not at us at the college level, but by each of the HODs with their nodal officer and the faculty. So far, the official NMC platform has not yet been opened. So, with the consent of the Honorable Minister and the Dean and the State Steering Committee, which our Additional Secretary will appoint shortly, and the DRP Monitoring Committee, in collaboration with the Director of Health Services and both the medical superintendents, we hope to start this program from the 1st of March because we don't want the next year's batch to be delayed. If we start on 1st of March, and we have seen for ourselves excellent facilities for accommodation are available in the South Goa District Hospital, and I'm told by the Honorable OHD as well as Dr. Vandana and the Director, there are about 4 rooms in the State Family Welfare Bureau which can be allocated for the male resident doctors. Am I right, Dr. Geeta? 4 can be accommodated. So the timetable will be made in such a way that pre and paraclinical PGs shall go to the North Goa District Hospital, work from 9 to 5, and the paraclinical disciplines like community medicine will go to either one of the North and South Goa District Hospitals, whereas the clinical will work only in the clinical specialties. Due to constraints of time, I have skipped my presentation in detail because the HODs and faculty are already aware, but the PGs will definitely benefit from it. I know from many of my own colleagues and my students that after finishing from GMC, those who finished MDMS, worked in the Directorate of Health Services as junior specialists, were confident to start their private clinical practice and move on to set up their own hospitals. So I do hope the Director of DHS, both the medical superintendents and the specialists under your control shall treat our students as their own children, as mentors. They will not be their PG guides because our faculty from GMC will be teaching them the PG teaching program. But we will see that your complement is completed and let us all work as a team. I thank all the dignitaries on the days and I accord on behalf of all of us a warm welcome to our Honorable Minister, our Dean, our Additional Secretary, Director of DHS, Sarpanch, Dr. Sandeep, the medical superintendents, the HODs, faculty and all of you. A warm welcome for this function. Thank you.
Thank Thank you, sir, for the brief outline. I now request Dr. Gita Kakodkar, Director of DHS, to share a few words with respect to the role of DHS in DRP.
Honorable Health Minister Shri Vishwajit Rani, Dean Dr. Bandekar, Nodal Officer for the DRP, Dr. Jagdish Kakodkar, Dr. Sandeep Sardesai, Joint Secretary Mr. Dattaram Sardesai, and Sarpanch Bambolin, Shri Vinesh Adpaikar. All the HODs, all the faculty, students, staff present here. Actually speaking, I first heard of this DRP. I had heard, we had read around that this DRP and the family adoption program would be starting soon in all the medical colleges, including the private medical colleges. A long time back I was here and I have got my degree in preventive medicine from Goa Medical College itself. And most of the people here are known to me. Dr. Bandekar also is my classmate. So we are, there should be no apprehensions on the part of any of the HODs that their students, PG students, will not be treated well or something like that. We are all one big family, and Dr. Jagdish has already said what the program entails. Now let me tell you one thing. Under the Ayushman Bharat initiative and the vision of the Honorable Prime Minister Shri Narendra Modi, we have a bottom-up approach now. All our sub-centers, our primary health centers are all converted into health and wellness centers, which encompass not only the treatment facilities, but they have to have certain amount of diagnostics, certain amount of medicines, certain amount of services they have to give. Besides that, yoga and other wellness activities are also to be conducted. So it is now a structured sort of setup at the primary health center level. Then coming up are our primary health centers, where of course the facilities are a little more, but as per IPHS standards, whatever is mandated is available in all our primary health centers. Our CHCs similarly have some specialist services, and our district hospitals of course are there with all the specialist options. But unfortunately we have been, not only here, in the whole of India, we have been a little, it's found a little difficult to recruit and retain specialists, though we have specialists, so that apprehension is not there. We have forayed a bit into academics also in the North Goa Hospital, where we have an extremely good laboratory. When I was medical superintendent of Asilo, we started off it was like a school chemistry lab. And I give full points to the pathologists there for bringing up to this level that we are the only district hospital which has a genome sequencing laboratory, which is ICMR recognized and also INSACOG recognized, which we got recently, maybe on Friday or so, we got the recognition also. So the HODs of pathology and microbiology, of course, will not have any, and biochemistry, of course, Dr. Dumi sitting there, my sister. So they should not have any apprehensions about your students, because we are running a kind of academic program there. Besides, we have certain, in GYNEC also, in GYNEC, we have diplomas. Yeah, DNB diplomas. So, sort of we are into academics, and this was what I felt should be the norm, means in a district hospital you are complacent and you are loaded with a lot of work, because basically the structure is one specialist, some specialist, and there's medical officers and that kind of setup. However, we have tried and we are giving good services in both the district hospital, and now the icing on the cake will come in the form of your we await the PG students, and you should have no apprehensions, because both Dr. Vandana, Dr. Rajan Borkar are well known to most of us, and it will be a a good situation for both of us. Maybe in the starting there may be some hiccups. We'll take care of each of them, because in case I'm unavailable for some being out of state or some conference, Dr. Rupa Naik also will liaison with the nodal officers here from the directorate level, so that any problems can be sorted out. Also the HODs, I would like to say that you have your own this FOXY and other organizations. So you have got a connect with all the specialists which are there. Most of them are from Goa, not from outside. So if you can take their phone numbers, in case they're academics or something you want from them, you can directly call them and talk to them, anything. So from the directorate side, we are ready to accept all the students, and well, the main thing is, like Dr. Jagdish had said, what this would do is fresh graduates. You work in a medical college setting when everything is there, but in a district hospital you have to make do with lesser this, but you can give the same kind of results and services. So the communication skills with the people will improve, and you will get a kind of maturity when you are working alone in a restricted setting. All our specialists, of course, are ready to be mentors. I don't think Dr. Vandana or Dr. Borkar will say anything regarding this. They're all very compliant, and Dr. Jagdish also can liaison with them. And anything extra you may need, you can talk to them and get it done. So another thing is your program, family adoption program. Since being from the preventive medicine field, just like Dr. Jagdish, this sort of, we used to, like he said, there was the Rome program, which was so long ago, I don't even remember what it was at that time. But this is an extension. Once we go out in the field, then you realize what the real problems of the people are and of that area. Now the DHS does not function like a medical college. We are a secondary setting and we are the compilers for the state. That's why we seek any good reports, any good practices from you, so that we can document it to the central government and see if we can move forward in any of the schemes. So the setting now is such that all of us are in one cascade and we all have to work together. So we have several programs, like we have a NCDC program where we have very less staff. So it is they have a CBAC form in which they go to every house and fill details about the patient and do certain tests. If he is diabetic, give this and advise. So this way the students will learn. And it will be very helpful to you. In Bambolim village comes under a PSC Chimbel. So I have spoken to Dr. Jude, and he will help you in any way he can. And of course the Sarpanch also is here, and he was kind enough to come here. So he has a connect with the people. So that way this program will go forward. So thank you once again for inviting me here and starting this program. Thank you.
Thank you, madam, for your assurance and for letting us know about all the work that is being done in both the district hospitals. I now request the respected Dean, Professor Dr. S.M. Bandekar, to share a few words on the DRP and family adoption program.
Honorable Minister for Health, Town Planning, Forest, Women and Child, Shri Vishwajit Rani ji, my colleague Dr. Jagdish Kakodkar, Nodal Officer for these two programs, Mr. Dattaram Sardesai, Additional Secretary Health, Sarpanch of Bambolim Village, Dr. Geeta Kakodkar, Director Health Services, and Dr. Sandeep Sardesai, Director Academics, the medical superintendents of both the district hospitals, my HODs, without whom these two programs are just not possible, the faculty members and their students. Both these programs, district residency program and the family adoption program are under the aegis of National Medical Commission. So we must understand that this is a part of our curriculum and not the extracurricular activity. Earlier, the roam program was just to roam in the village, so it became an extracurricular activity. Let us not roam in the villages. So family adoption means you go to the families. It is an experimental study and you will learn a lot of new things in this program. So I would in fact suggest the students of the MBBS to use this platform to get close to the people of the village. As you are aware that 65.5% of our population is the rural population. There are people who get very good health care when you stay in the urban areas. And many a times we also say, where is rural area in Goa? There are areas and there are some villages, there are some houses in Bambolim village. Out of those 4,000, I was told at least 350 villages are to be adopted, families are to be adopted, which are actually having no contact, have no access to the health care. So please use this platform and develop your rapport with the patients who are deprived of health care. Our Honorable Prime Minister also has mentioned that doctors in India are so busy and the ratio of patient to doctors is so much of sparse, that is one doctor for 900 people. So you can become a kind of a mini doctor for them, help them to get access to Goa Medical College and see that you follow them up. You will get their medical history. You can do a lot of social work in this also. You will learn to take history about the patients. You can also give them ideas on well-being, how to be having preventive aspects of the sickness. As regards the district residency program, it is to expose the PGs to district health system. The district health system is really the backbone of state's health system. We at tertiary, we would only do teaching and we'll do a lot of tertiary work. But the masses are treated at the district hospital. So please understand that when you go to district hospital, you can help the masses. You can help people who are not able to get health care otherwise in the tertiary hospital. My only request to Honorable Health Minister today is to see if we can give them some kind of incentives on those 3 months, because every year, every district resident will be working for 3 months. They will have their salary. We are not going to cut their salary for 3 months. But in addition to that salary of residency, I feel, sir, if you can take this issue and then give them some incentives so that they will work more, hard as a district resident. And all of you are aware of both the programs. Today we are launching it. It will be one of the feather in cap in the medical college of this country. Your medical college will now not lag behind as compared to other colleges in the country. So I wish you all the luck, and I would like to thank the Nodal Officer, Dr. Jagdish, for his initiative in both the programs. Thank you.
Thank you, sir, for your kind words. Proceeding further with the formal inauguration, I request the Chief Guest, Honorable Health Minister Shri Vishwajit Rane, and all the dignitaries present on the dais to proceed towards the plaques and unveil the plaques for the DRP and Family Adoption Program. I now request Honorable Health Minister Shri Vishwajit Rane to share a few words on both these projects.
Dean Goa Medical College, Dr. Bandekar, Additional Secretary Health, Sardesai, Dr. Geeta Kakodkar, Director Health Services, our Sarpanch of this area, Shri Vinesh, Dr. Jagdish, and Dr. Sardesai, in charge of academics, and all the HODs and all the students present here today for this important function. Actually, this is something which Dr. Bandekar was mentioning to me, and also this was recently discussed and mentioned by the Honorable Prime Minister in one of his interactions with all of us. And as a result of which, it was, I think, made mandatory for all the colleges across the country to implement this. And I think this is something which is very important and is very useful also for the students, and especially the first year students in terms of the family adoption program or your district residency program, where batch wise you will get an exposure of working in the district level hospitals. And I think as far as Goa is concerned, and the vision of the Prime Minister which we are trying to implement here, I think for us in the state of Goa, we are a small state. And in the small state, our infrastructure is also much better than when you see larger states, and if you have to, you talk about district hospitals in those states. I think we are far better off as far as the state is concerned. And all of you, and especially the students who have just joined MBBS, I think it will be a good experience for all of them in terms of the family adoption. And also Bambolim is just close by and nearby, and I think it will be a good interactive kind of thing, and also a learning under your respective, your professors will be monitoring this particular program, guiding you accordingly. And also in terms of outreach, many times we make it as a slogan. We say that we are going to take the delivery to the doorsteps of the people. But this is actual taking healthcare to the doorsteps of the people. And the vision of the Prime Minister, and I think this is his vision which we are all implementing. And not only implementing because it is his vision, because it is something that is going to benefit the society at large and benefit the people. And also in terms of your district residency, all the students who will be posted at the district hospitals, north and south, we have got our team from the DHS also. I think there will be thorough, proper coordination, and I think this will be beneficial not only from the students' point of view, but also from the patient's point of view. And for all of us also, this will be beneficial when a batch of students goes there. It will help in providing additional services to the patients who come there. It is very important. Many times earlier, we used to make it mandatory, make various rules, and trying to see that, the doctors, after it's your, like after your internship, you practice in a particular place or something like that. But I think now all this is getting more structured, and this is going to get more structured and become more, it's going to become much more meticulous. And I think what the Prime Minister is trying to do, and what the Honorable Prime Minister is doing, is going to help in creating a kind of a system which benefits all of us. Otherwise, earlier what we used to do, we used to force somebody, you need to go and do, or you need to work in a rural area for this much time. Actually now, with proper application of mind and proper thought process, I think this structure, like they said, that your person doing a residency will be spending 3 months, then the next batch goes there. So all this will be structured. Otherwise, it is getting, in each state they had we all had different rules. We also are under, even today we are under pressure that to run the systems in the health services, that we require more doctors, we require more staff, we require much more, a larger number of technical people. But I think this is something which is very important. I won't take much time. Dr. Jagdish has already mentioned it at length, the methodology of implementation. Dean has mentioned, and definitely if Dean puts up a proposal pertaining to the PGs, what is the benefit or incentive that we can give them, definitely the government will consider. And our Sarpanch, Mr. Vinesh, I am sure they will support us. And this is something which is very important and needed to be started for a long time. I am only hoping and praying that this whole structure, how everything is to be made more in a structured manner even after you finish your MBBS, so that every state follows the same principle and same model. I think that is very important. And I would like to wish all of you all the best. And these two programs, which has come out through the thought process and the vision of the Honorable Prime Minister, I think we all need to be very passionate about it and implement it in the true sense. Thank you so much.
Thank you, sir, for sharing.
And I think what the prime training 3 months, then the next batch goes at length, the methodology of implementation. Dean has mentioned how everything is to be made more in a structured manner even after you finish your MBBS, so that every state follows the same principle and is passionate about it and implement it in the true sense. Thank you so much.